Hi, I'm Sarah.
And I'm Dean. And in this video, we're going to talk about psychosis, and we'll talk a little about schizophrenia.
So what is psychosis?
People with psychosis can lose touch with reality and with what is going on around them. They might see things or hear voices and sounds that other people around them don't see or hear.
Sometimes, people with psychosis believe that things are happening to them that other people around them don't think are happening at all. They can also have behaviour that's a bit extreme or bizarre, or that seems to make no sense. They can believe that others are trying to harm them, or believe that they're a famous person, or just somebody other than themselves.
Psychotic symptoms can occur with different mental health difficulties. For example, with depression. This can be over a short or a long period of time. A psychotic episode can occur following a traumatic event and can last a shorter period and resolve quicker with the right treatment and support.
If someone has a lot of psychotic episodes over a long time, they might be diagnosed with schizophrenia.
If your parent experiences psychosis or you live with someone who does, it can be a bit scary and confusing to work out whether what they're saying is true or not. You might then start to believe that the things they report seeing, hearing, or believing are actually real, and then sometimes the world can feel very frightening for you.
Yeah, like they might suddenly say, "We have to run because someone is chasing you." So it can be really hard to work out what's actually going on. It can also be very hard to feel safe when your parent is so frightened and anxious because of what they are hearing or seeing.
The main thing to remember is that these experiences feel very real for your parent or relative. They're not making it up, they're not trying to trick you. They're also not doing it on purpose. They really believe that these things are happening. And in an odd way, their bizarre words and behaviour are an attempt to protect you from what they fear will happen. It can be quite scary for them, and also for the families around them.
So where does psychosis come from? Psychosis is a mental health disorder. For some people, psychosis can happen after very big traumas or stresses in their lives. The trauma can result in chemical and structural changes in some people's brains that can be expressed in psychotic features. In most cases, there is what's called a genetic vulnerability. This means that it can be in other relatives too.
Yeah, that's true. But it doesn't mean that if someone in your family has psychosis or has had a psychotic episode, that you will as well.
No, not at all. As we said earlier, the majority of people who experience psychosis have had significant trauma in their lives. Therefore, what is in the genes does not always emerge, but sometimes factors in the environment like traumas or extreme stressors cause the brain to become so overwhelmed that it can lead to psychotic symptoms.
So what is trauma? Trauma is an experience or a series of experiences that is very upsetting and difficult to cope with, like being in a fire or war or an accident. Experiences of violence or being treated badly over a long period of time can be traumatic also. For some people, trauma can be very upsetting and can take up a lot of their headspace.
Prolonged trauma, or trauma and distress over a long period of time, can actually change how the brain works and the brain's ability to deal with stress. For people with psychosis, the trauma leads to brain changes that can then lead to symptoms of psychosis, which can themselves lead to more brain changes.
Yeah, this is why that the earlier people with symptoms of psychosis get help, the better the health and recovery outcomes. Getting support and treatment early on can reduce how much the trauma and psychotic features become bedded down in the brain.
Now, maybe you're thinking, I have daydreams, I have conversations in my head. Does this mean that I have psychosis? No, not at all. Having daydreams or conversations in your head is very normal, and it can be a way for the brain to figure things out.
Absolutely. The big difference is when you daydream or have those conversations, you know they're not real. And you know that other people can't see or hear them. They're just in your head.
So like we said, for people with psychosis, it can be really hard to separate out what is real and what's not real. When people experience a psychotic disorder like schizophrenia, they can have experiences that seem very real to them, and they can feel like they have no control over what's happening.
And when they believe in stuff that isn't actually happening, which is called delusions, they're not doing this on purpose. As psychosis is an illness, they're not likely to be able to snap out of it either, or feel better without proper help and support.
So, if you want to know more about where a mental health disorder like this comes from, check out the video on this website. What is a mental health difficulty?
So if you are watching this because you're wondering if your parent or someone around you experiences psychosis or has schizophrenia, it might be helpful to know what it can look like. It is also important to remember that the symptoms of psychosis can cause mild to very significant interference in daily life depending on how frequent and intense these symptoms are.
Hallucinations. The person with psychosis might see, feel, hear or smell things that are not really there. They might hear voices that tell them to do or say things that they wouldn't normally do or say. They may believe that ordinary objects are talking to them or giving them instructions.
The person may also experience delusions. For example, they may believe that people on TV are talking to them directly, or they may believe that something is happening that isn't real, or they might believe that they are someone else. For example, somebody very famous.
They might also appear distressed. They can have trouble concentrating or listening to other people in conversations, because they can be so distracted by all that's going on in their head. This can go on over a long time, weeks or months, or for some people even years. However, not everyone experiences psychosis or schizophrenia in the same way. These are general symptoms of psychosis.
Remember, you didn't cause this. It's not your fault, and it's not your job to make your parent better either.
But the good news is that there are things they can choose to do to get help. For instance, talking about it helps, or getting support from other adults.
Yeah, like sometimes seeing a psychiatrist, taking medication, or seeing a psychologist, or other professionals trained in this area can help people with psychosis. There are special individual and family interventions that can help, not just your parent, but also the family around the parent.
Psychosis can be scary, and children and young people who have a parent with psychosis sometimes report that it can be hard to deal with, especially if your parent is experiencing hallucinations or delusions. However, it doesn't have to last forever.
Remember that lots of people with mental health difficulties can and do get better, and go on to enjoy their family, their friends, and all the other parts of their lives. If you would like to know more on how people can get better, check out Recovery on this video series for more information.
Having a parent with psychosis or schizophrenia, or living with someone who does, means it's really important that you look after yourself. Do things you enjoy, find someone to talk to, and have some space.
This is really important. And while it can be worrying sometimes, there are people there to help your parent. It is really important that you look after yourself. Check out self-care in this video series.
Try to find someone to talk to about some of your worries. It could be a parent, or a family friend, or a trusted adult. If you wish to speak to someone you don't know, then call the Childline helpline. They have people trained to support you, and it's a confidential service. Their number is on the screen.
It also doesn't always have to be a crisis to call them. You can just ring and see what it feels like to talk about it. You can talk about how psychosis in your family affects you. Maybe talking to a stranger will be good practice for talking about it with people you know.
That's true. It can be very important to talk to other people about it. If you think it would be helpful, check out the information available on yourmentalhealth.ie. You can also check out some of the other videos on this website.
And remember to take good care of yourself.